Hello, I'm Dr. DeShawn Taylor. I'm a board certified gynecologist and family planning specialist, and I am the founder and CEO of Desert Star Family Planning in Phoenix, Arizona. I founded Desert Star Family Planning in 2013 with the vision to provide just, dignified, and exceptional care to the women and families of Arizona, and more specifically, providing this care in a patient-centered manner, inviting our patients to be true partners in their health and wellness. And so as I look to the future in growing and measuring whether we are delivering on that value proposition, there are three metrics that I am looking to follow. And those are revenue growth rate, revenue per dollar, and patient volume growth rate. And so starting with the revenue growth rate, in 2018, the growth rate of the revenue was 47%. And so that was a great year of building the practice. And unfortunately, what happened for 2019 is as the lease was coming up to be renewed, the owners of the building were not delivering on promises to keep my staff, myself, and my patients safe. Over the course of the lease, the building changed ownership, and the individuals who took over the property did not keep up the property. In the neighborhood that we were located, there was a growing population of homeless and substance-using individuals who were actually starting to take up residence in the area of our building. And so I made the difficult financial decision to move, and I did raise funds to assist and offset the cost of that. However, in 2019, we did not see revenue growth as there were several months in the new location where we had to reestablish patient volume. And now in 2020, we have a global pandemic. And so we have seen some revenue growth to date compared to 2019. That is 0.71%. And I'm happy to know that we are able to do this in light of having a consistent patient volume from day to day and week to week during this pandemic. Also during the pandemic, the cost to provide services has increased substantially. There has been difficulty in getting supplies that are needed. I am medical practice and we're in a pandemic, and so hospitals get first priority in receiving a lot of things. And then when there's a vendor that has what I need, the price is marked up due to demand. And so that is definitely impacting the revenue per dollar. To date, the productivity ratio is 1.15. Now, that was 1.29 in 2019 and 1.17 for 2018. And so what I can say related to those numbers, though, is that incremental increases in my salary as a physician, as revenue increases, will keep this metric closer to 1. But a revenue growth of just 30% in 2021 would increase my revenue per dollar to 1.56 productivity ratio, and this is a feasible goal. And so based on some of the changes that I have upcoming planned for the practice model, I see myself getting this productivity ratio closer to 2, but again, as my physician's salary is a part of this number, then that is a driver for that. And so in terms of patient volume growth rate, the growth rate was 18% in 2019, despite the fact that we did move the location. So that was really awesome to see. Now, that basically was a reflection of a little bit more mix of services as I tried to market and expand other types of services that I was providing to mitigate the loss to the loss of volume of our larger paying, our larger revenue generating visits. And so The last 6 weeks of visit data lets me know that probably we're going to end up with a similar volume to 2019 and a growth rate of 0 for 2019. I will share that planned changes to my practice model, like increasing availability of telehealth visits, will help meet patient volume growth rate goals despite a continuing pandemic. We, of course, are expected at this point to be continuing on a significant pandemic into the first few months of 2021. And so my daily visit average right now is 10. And there are days when I see more than 20 patients and days where I see less than 10. So I have the capacity to do 15 visits easily with current staffing. This alone will increase the patient growth volume to 40%. And so I'm feeling really good about the prospects of the business moving forward. And so thank you for taking a moment to come along with me as I kind of think through these things and share out. And so that's all I have for now. Thank you.